breast cancer?
It appears in the breasts, and it is. Okay, I know that the cells start to accumulate.
والله أنا ما بعرف أشياء عن breast cancer.
What do you know about breast cancer?
It's increasing yearly, and it usually happens with grown women, but recently it's been happening to even younger women, the adolescents.
What do you know about breast cancer?
I don't know much, but I know that women above the age of 35 should have a yearly a yearly checkup like mammography, and they should always consult their doctor. That's it.
What do you know about breast cancer?
Nothing.
What do you know about breast cancer?
براست كانسر هو كانسر بس كثير ضروري وكثير مهم انه المرأة تعمل كل سنة بس تصير فوق يوجوالي فوق ال 30 ضروري تعمل فحص للبريست كانسر لانه البريست كانسر اذا كشفوه باوله بيكون كثير بيقدر يتعالج اذا لا بعدين بيصير وبينتشر بالجسم وبيصير كانسر اكثر من بريست كانسر وبيقتل صار عم بيضرب عالم اقل من 30 years يعني اذا from 25 حتى عم بعرف بنات عمرهم 18 عم بيكون عندهم بريست كانسر فاذا بدها حيلا مرة اذا بتحس في شيء فورميشن بجسمها غلط ما تقلل من اهميته تروح تشوف الحكيم لانه يمكن يكون ماشي ويصير شيء كثير فان شاء الله اكون قدرت ساعدك بهيدا الشيء.
Breast cancer is a malignant tumor that starts in the cells of the breast. A cancerous lump is often hard and immovable and feels like a lemon seed. Cancer occurs as a result of mutations or abnormal changes in the genes responsible for regulating the growth of cells and keeping them healthy. Breast cancer is the uncontrolled growth of breast cancer cells. It can transport from one part of the body to another. Usually, breast cancer either begins in the cells of the lobules, which are the milk-producing glands, or the ducts, which are the passages that drain milk from the lobules to the nipples. Less commonly, breast cancer can begin in the stromal tissue, which includes fatty tissues of the breast.
5 to 10% of cancers are due to an abnormality inherited from your mother or father, and 85 to 90% of breast cancers are due to genetic abnormalities that happen as a result of aging process, which is why women over 50 are more likely to get breast cancer. Woman's exposure to the hormone estrogen, the more susceptible she is to breast cancer. Estrogen tells cells to divide. The more the cells divide, the more likely they are to be abnormal in some way, possibly becoming cancerous. Researchers have identified 2 genes responsible for some instances of familial breast cancer. These genes are known as BRCA1 and BRCA2. About 1 woman in 200 carries the genes.
The graph also shows that there is a 20% genetic risk factor and an 80% environmental risk factor. As talked about in the slide before, researchers identified 2 genes responsible for breast cancer. The 2 hereditary mutations are BRCA1 or BRCA2. In the pedigree shown, the father showed to have the BRCA1 or BRCA2 mutation. The BRCA1 or BRCA2 mutation is dominant over the normal allele. The children showed to have a 50% chance of inheriting this mutation regardless if the child was a male or a female.
In rare cases, men can also develop breast cancer. Less than 1% of all breast cancer cases develop in men, and only 1 in 1,000 men will ever be diagnosed with breast cancer. Breast cancer in men is usually detected as a hard lump underneath the nipple and the areola.
The picture shows possible breast cancer signs: the redness of the breast, breast swelling or enlargement, pain or itchiness of the breast, thickening of the skin on the breast, and ridged or dimpled skin textures. Swelling of the lymph nodes in your armpit above or below the collarbone as shown in the pictures. Breast cancer can have 5 stages. The higher the stage, the more advanced the cancer is. The stage depends on the combination of the tumor size, lymph node status, and metastasis. Metastasis is whether or not the cancer has spread to other areas of the body. Stage 0, the cells are limited to within a duct and have not invading surrounding tissues. Therefore, there is no metastasis. Stage 1, at the beginning of the stage, the tumor is up to 2 centimeters across and it has not affected any lymph nodes. Stage 2, the tumor is 2 centimeters across, but it has started to spread to nearby lobes. Stage 3, the tumor has risen to up to 5 centimeters across and it may have spread to some lymph nodes. Stage 4, the cancer has spread to distant organs, especially the bones, liver, brain, or lungs.
5 standard treatment options are there are 2 types, local and systemic. The local types are surgery and radiation. The systemic types are hormone therapy, chemotherapy, targeted therapy.
Breast cancer is the second leading cause of cancer death in women. The first is lung cancer. 98% of breast cancer patients survive when diagnosed early. 85% of breast cancer occur in women with no family history. However, the risk is nearly doubles in women with a first-degree relative with breast cancer. Starting at the age of 40, women should talk to their doctors about starting yearly mammograms. The earlier the detection, the more likely the cure. There are many ways to stay healthy and decrease your risk of getting breast cancer. However, there is no way to eliminate your chance of getting breast cancer. Some of the ways are maintaining a healthy weight, limiting alcohol use, not smoking, eating fruits, vegetables, and whole grains, and exercising for 30 minutes a day. Therefore, having a healthy lifestyle.